everyone. My name is Joy Rustoven, and I am the Executive Director at Survive It. Today we're going to talk about what a conversation could and should look like. So we know that many of us, after receiving a diagnosis, we just jump into the first available treatment, usually out of fear. We just want something in our body fighting the cancer, and we totally get that. Something that we want to impart today is the notion that there are some doctors out there who are better at treating certain types of cancer. And so it might be a good idea, and it usually is, to get a qualified second opinion. And there is a difference in cancer care across our country. And so we thought it might be helpful in talking about what a conversation should look like, so you then know if you're having these conversations, which you should be, or if you're not, and you need to maybe find another provider who's more equipped to handle your type of cancer. So I'm pleased to introduce Dr. Prasanth Reddy from Foundation Medicine today. Welcome.
Thank you, Joyce. Pleasure to be here.
So I know this is a difficult topic to cover because we want to be respectful. We know that every physician out there has good intentions. But we also want to make sure that the patient is informed and able to effectively advocate for themselves. Your medical team is there to be a part of the conversation and guiding you to the very best treatment possible. So we'll kind of start there in the sense that selecting the right doctor for your specific type of cancer and the treatment that is then suggested from there.
Yep, absolutely, Joy. I would say that the first step is having that rapport, that personal connection. And that is as important as anything, because that connection that you have with your physician is critical to building trust. And that's where everything starts with every single interaction you're going to have for your entire cancer journey is, am I comfortable talking about the things that I need to talk about? And the person I'm sitting across to isn't going to judge me. At the end of the day, do not worry about what other people think. At the end of the day, this is about being comfortable that we are doing everything we possibly can, and you understand why the decisions that are being made, right? We, in an earlier session, talked about, understanding, what do I have? Where is it? What am I going to do about it? You want to take as much time as you need to get an understanding of all of those pieces of information, right? It's not uncommon when you first come into a doctor's office, especially that initial consultation, and we try to go through as oncologists a lot of that information, that you only remember maybe a quarter, 25% of what you've been told, okay? So I would encourage folks to bring a journal, bring a folder, write things down. The conversation with your cancer team does not end when you leave that clinic office. If you're going to the infusion area, those conversations continue. Why? Because your pharmacist, your nurse are also part of this team. As you're thinking about what you need to have to be comfortable, whether it's symptoms, whether it's the treatment itself, you want to be in an environment that is protecting of your ability to ask these kinds of questions. At a different level, what I would say is, if you're ever having discomfort or not understanding why certain things are happening, or you don't understand the diagnosis, or why a specific treatment's being chosen, you should never feel like getting a second opinion is something that's a bad thing. In most of the cases that I've had folks go out and get second opinions, I encourage it. And the reason why I encourage it is because it only strengthens that trust. Right? It only strengthens that trust. And the other aspect of that is, sometimes maybe I go to a second opinion in another institution, and perhaps they have other treatment options that I couldn't offer in my institution. By that, I mean maybe there's a clinical trial option. You owe it to yourself to look at every single thing. It is entirely appropriate. In fact, I encourage you to do that. And if you do come back to your original doctor, and many people do come back to their original doctor, what you've now done is strengthened that relationship, not weakened it. Because you've come back and you said, doctor, I listened to what you said. I really appreciated the fact that you encouraged me to go out and felt comfortable for me that we were doing the right things. And I came back to you because of that. And so when you have that relationship, trust me, if anything, it's going to strengthen it, not weaken it. And if for whatever reason, it turns out that you feel like, gosh, it seems like it weakened it, then that's probably not the right place for you, right? And what you've done is, you've gotten the information now where you can feel confident that, gosh, maybe this isn't necessarily the right situation for me. And that's a very important thing as we go through, the cancer journey.
So you said the word confident, and I think that is something that I think we should talk about, because a lot of us will gravitate to the physicians who have really fantastic bedside manner because they bring us comfort. And while that's really nice to have, what are some things that we can look for or ask to make sure that whoever is sitting in front of us, whatever medical oncologist we're speaking to, we can be confident that they are doing everything that they possibly can and that I am getting, or my loved one is getting, the very best treatment possible?
You may ask additional questions like, do you only take care of this kind of cancer, right? Do you only take care of lung cancer, or do you take care of all cancers? And it's not that people can't take care of all cancers, but you're clarifying, right? And then your next question is, if you don't take care of all cancers, how many folks, do you feel fairly confident and comfortable taking care of patients that have my particular cancer, right? All of this goes back to trust and openness, right? So when you ask that question, you shouldn't view it as, gosh, I'm questioning the doctor, right? The doctor should view this as, boy, they're comfortable and confident enough to ask me these questions. And that's what I need. That's what I need, because when I'm making treatment decisions, right, there is no single right treatment decision in many cases, right? And that's something that's hard to wrap our heads around. It's what's the right treatment decision for me at that time. And a lot of that comes with that bedside manner, but it's not mutually exclusive. If you have a doctor that's very good in understanding, say, the science, but they have no bedside manner, that is not good medicine. And vice versa. You can have a doctor that's the nicest person in the world, but if they don't understand the science and how to take care of your cancer, that is not good medicine. You owe it to yourself to find somebody that can do both. And there are plenty of people that can do both. So don't sell yourself short. Research things yourself. That's another way you can empower yourself. So when you ask a doctor a question, you can ask them, hey, I read this. Can you verify that this is the case or not? Be educated, right? So all of this cannot sit on the doctor itself. If you're not invested in taking care of yourself, who's going to be more vested than you? You owe it to yourself that you're educated on the issues as best as you can be. It doesn't mean you're going to go get your MD tomorrow. That's not the job, right?
Yeah, and I want to go back to your comment about the doctors that see multiple types of cancer. So at Survive It, we highly recommend everyone gets a qualified second opinion. And that means speaking to someone who specializes in your type of cancer, especially if you are seeing a general oncologist.
The other truth of the matter is that a lot of times you can go get that second opinion, get that therapy recommendation, and do it closer to home. So you can have both things. It fits within the framework of good medical care. And it is a collaboration.
Yes, and I also want to mention that if you are unable to travel, if you don't have the resources, the time, there are companies who offer remote second opinions. So that's also an option as well. Until next time, stay strong and live fearless.